Hi everyone, it's Emma here, and this week I am exploring the topic and answering the question, how do I stop period acne? So I think acne and skin concerns can crop up for a woman at any stage of life. The teenage years and sometimes in the approach to menopause can be more problematic due to those more pronounced hormonal fluctuations. But then it can be something that women notice each month. Perhaps they suffer a bit more from acne around the time of their period or in the approach to their period and that premenstrual period. So it's something, again, like everything else, that women can often struggle to deal with to varying extents, and then of course ask, how can I handle this? How can I deal with this? And as usual, we are looking at some of the underlying causes to help you manage those symptoms, which to some degree are individual to you. So I'm just going to talk through some of the potential mechanisms and then just offer up some tips of potentially what could help. So first of all, it is important to consider if there are any hormone imbalances. So naturally, there will be a natural drop-off of hormones each month which give us our period, and it could just be this natural drop-off that then triggers these skin complaints. So you can track your symptoms in order to help determine when these symptoms are cropping up, and this could give us some indication as to how your hormones might be contributing. So as I say, each month when you have your period, there is a drop-off in both estrogen and progesterone, two of our primary sex hormones. Now, these are traditionally known as the female sex hormones, but women also naturally have a small amount of testosterone, which is the male sex hormone. But what happens is, as progesterone and estrogen drop off, they're quite low during this lead up to your period, testosterone can actually be higher relative to these other female sex hormones. And testosterone can increase the sebum production in our skin's pores, and potentially this could be one of the mechanisms that can give rise to acne and skin issues around the time that our period is due. Now, what I would say is this natural drop-off of hormones is normal. So to some degree, skin changes might be expected around this time. As always, if symptoms are quite pronounced, quite severe, we would be looking to understand a bit more about that. Is there a more pronounced hormone imbalance going on, such as your estrogen dominance, in which case Agnus castus might be useful, or if we're likely to be low estrogen, which can create greater skin issues. If you're low estrogen, your skin can become slightly dry or slightly more sensitive, and that could also exacerbate skin conditions. So it's important to try and consider all your other symptoms, your cycle as a whole, to help determine what might be going on with our hormones. If it is a more pronounced hormone imbalance, that should be the primary call of action to try and deal with that and try to sort that. Or if we suspect it's just a natural drop-off of hormones, which make us slightly more vulnerable at that time, then hopefully the other tips throughout this blog should be enough just to help protect your skin a little bit more when it's at that vulnerable time. So that's just one to consider initially in terms of the hormones, as that is very likely to be an underlying contributing factor. Now, moving on, as I say, the hormones are the first and foremost area to focus on, but of course there are some other tips which can help just to keep your skin protected during this time. So my second point is to keep hydrated. So this is particularly important around the time of your period, although every day throughout your cycle, hydration is key for most bodily symptoms. But in terms of your skin, hydration is really important, especially if our skin is a bit more vulnerable at this time. As I say, improper, if we're dehydrated, it can make your skin more dry, more sensitive, more vulnerable to injury, and then bacteria is more likely to be able to get in, and that can contribute to kind of angry acne as well. So it's important to keep hydrated to keep your skin nice and plump and protected. So as usual, we aim for between 1.5 to 2 litres of plain still water daily. Then I'm going to move in next to talk a bit more about your diet more specifically. So this is a time where, as your hormones drop off, we're a bit more vulnerable, and this puts us in a slightly more pro-inflammatory state, both in the lead up to your period and also during those first few days of your period. So we are looking to try and reduce inflammatory ingredients of our diet, which in turn can then help to protect our skin. So some inflammatory ingredients would include your refined sugar, artificial sweeteners, caffeine. All of these are pro-inflammatory and also can adversely affect your blood sugar levels, which in turn can have some negative effects on your skin. Refined carbs are the other ones, so those white bread, white pastas, processed goods that are high in sugars and these simple carbohydrates, which then affect your blood sugar and also your stress response, which we'll go on to in a bit more detail. When we talk about carbs, we also have to consider the balance of your plate. So I would never usually suggest cutting carbohydrates out completely, but what you can do to help lessen the blow of those carbs is to include lots of a good proportion of healthy fats, healthy proteins with every meal and snack. These healthy fats, particularly sources of omega-3, such as with your oily fish, your nuts and seeds, these are also anti-inflammatory. So not only are you lessening the effect of these more refined sources of carbs, but you're also including an anti-inflammatory ingredient, which is going to have other benefits beyond lessening the blow of the carbs. Then we also have parts of our diet to consider in terms of how it impacts on your digestion. So dietary components such as dairy, gluten, heavy animal proteins, these are harder for your digestion to digest, and this in turn can have effects on your immune system, which in turn can have effects on your skin. Also can ignite the stress response as well if your digestion isn't sufficient. So dairy, gluten, heavy animal proteins, these are just ones to consider for you as an individual, how well you're able to tolerate them in terms of your digestion and potentially what effect that could be having on your skin at any given time. So as I say, it is individual, but just consider how different food triggers might be affecting you, and potentially we might need to support your digestion more specifically in some cases. Next on my list is stress. Again, stress can affect the skin at any time, but it might just be that we're a bit more vulnerable as those hormones drop off at the end of the month. Stress can ignite a number of stress hormones, and histamine is also often released in response to stress. And histamine is released through the immune system, and histamine can give rise to kind of redness and irritation, which more directly affects your skin. So stress is one to consider. Stress also directly impacts your digestion, which we've spoken about, and it may then mean you're less able to tolerate certain dietary components, which again could negatively impact on your skin. We also have elements of our diet, which we've mentioned already, which could actually ignite your stress response further. One of the main ones there to consider would be caffeine. Again, it might just be one to consider at this time of the month that your tolerance to caffeine might be slightly lower, and that stress response is just having an extra effect on your skin. So I would say to try and reduce your caffeine content slightly and just increase your water. So just be a little bit aware of that balance. Next, we're wanting to consider some of your primary exit routes of toxins. So especially during the time of our period, there's things like these pro-inflammatory prostaglandins which are released. We might have other toxins through our diet that we just generally need to excrete. And if the toxic load becomes too much, potentially the skin can suffer. So the skin is one of the secondary exit routes for toxins. So if some of our primary routes are a bit blocked or not working as efficiently as they should be, then your skin could suffer. So some of the primary exit routes can include your bowel. So that is if you're going to the bathroom at least once a day, if not twice a day. So if you're not going to the bathroom regularly, if you're constipated, this can create a backlog of toxins, which puts pressure on the liver and beyond. It can also end up affecting your skin. Your breath is another primary exit route for toxins as well. So nice deep breathing, particularly the exhaling. So sometimes we just need to remind ourselves to take a moment to breathe and to really focus on that. And of course, stress is going to negatively impact that. We're more likely to take shorter, shallower breaths if we're stressed. So this is just another tip to be a bit more conscious of the breath. The breathing is also specifically helpful for some symptoms of periods as well, such as pain management and things like that. But primarily here we're talking about the relaxation and the exit routes for toxins. So those are ones to consider, just to try and take the pressure off the skin as one of those secondary exit routes. Lastly, I just want to consider your skin routine. So whilst this isn't so much my area of expertise, and as we've explored, often skin complaints are coming from within in terms of your hormones, how your digestion is working, and how you are handling stress, your stress response. But of course, what we put on our skin topically is also important. So trying to include a good cleansing routine to help unblock those pores and keep your skin nice and clean, but also trying to prioritise more natural products as well. We don't want any ingredients in there that could potentially cause further irritation, and also just be aware of expiration dates on your products as well, because keeping them for too long could increase the risk of bacteria and things having negative effects. So hopefully that's been helpful for you. As always, please leave any comments or questions below, and please do subscribe to our Evolgo YouTube channel, and also hit the bell icon so you will be notified of any future videos. Thanks!